What I'm here to do today is to set out the government's attitude to self-care, to indicate our support for this movement and to provide some wider context as well. The main challenges are really about attitude and behaviour. This can be a very threatening thing. It can be threatening to you as an individual. Why is the NHS not doing things for me? It can be threatening for you as a professional. Why am I suddenly having my professional expertise challenged? In both cases, we have to make people understand that it's not about them doing less, it's about them doing things differently. It's about them having a new relationship, patient and professional, both experts in the needs of that individual and how to best meet them. And if we can see that as a partnership, I think we'll get far more out of it for the individual and we'll give the individual what they want, which is control over their own lives. In the past, too often we've expected people to become experts at navigating the system. They're expected to be malleable, flexible, to fit in with the convenience of systems, fitting their needs into institutional boundaries often created 60 or 70 years ago that are only sustained by tradition or in some cases, dare I say, inertia. So what we're asking instead is for an understanding that people's life experiences matter, that it's by understanding these experiences that we can change people's behaviour. More is going to be said about that later. So it's not a diminished role for the state we're talking about, it's a changed role. It's a state that's not defined by the buildings that house our public services, the local hospital, the care home, or the GP surgery. It's about the interactions, the relationships between professionals and people that they work with and for. Where the default question is, how can we put people in control? How can we get people more involved in the decisions about their health and their care? What kind of information, encouragement and support do people need to understand how choices that they make will affect their health and well-being? This demands, I believe, a massive cultural shift, both from professionals and from the wider public. I mean, a lot of change, you sort of have to have the alchemy of good leadership. That's the sort of ingredient that is hard to sort of quantify and define, but is essential, and that's why we do need the Royal College of GPs engaged in this in the way they are, the Royal College of Nursing, and other clinical leaders to see the value of this change of culture and behaviour. And we need to have the patient's voice very clearly and loudly heard in the discussions as well. But then you can move into all the sort of technical language of tariff design, of sequins, and goodness knows what else that can incentivise and drive the system to behave in different ways, and certainly that has to be part and parcel of the conversation. I look forward to the challenge, and I think we do have a challenge if we are to make self-care a reality, because we know if we make it a reality, it is much, much better for our fellow citizens, and it also delivers the dividend of using the resources the taxpayer puts in to deliver the very best possible outcomes, and I hope that's what we all are here to achieve. Thank you very much.